Hi, my name is Nicholas Yates, and this is my rehearsal speech for the informative speech that I am going to be doing here soon. And now I'll begin. Hi, my name is Nicholas Yates, and I'm a resident in Donauer Hall on the 5th floor. Here at Hocking College, I am studying to be a registered nurse, so I'm in the nursing program. My topic is the 3 major diseases and infections that occur in dorm rooms that people need to be aware of while at college. I'm going to ask everybody a question. How many deaths do you think occur due to the influenza virus each year? And so I wait a little while, get some answers, and then I would go off with this. There are 11,300 deaths each year due to the influenza virus. I believe that number is kind of high considering the technology and information that people have availability to due to the internet and things like that. In my opinion, that number should be a lot lower because of just like I said, the infections and everything that we have today can be cured so much faster and easier than before. I've done my research for this speech on databases and credible internet sources, as well as some places from classes that I have had in the past, so to have a good background on this topic, so this information is reliable. Mononucleosis, meningitis, and the flu virus are all infections and or diseases that everyone needs to be aware of while living in dorm rooms at college. Remember, mononucleosis, meningitis, and influenza. The influenza virus basically is a virus that attacks the upper respiratory tract of the body, which include the lungs, esophagus, trachea, pharynx, and everything else that's in the upper body. Droplets that have the virus inside of them are in the air and on surfaces, and when people come into contact with those viruses, that's when the virus enters the body and starts to attack the immune system. In case anybody doesn't know, you are contagious a day prior to when symptoms occur throughout the body. So just because you don't feel good doesn't mean that you're not contagious and can spread the infection or virus. The flu virus is constantly evolving over time, so it's never really the same month to month, year to year, day to day. It's constantly evolving and changing, so your body has a hard time keeping up with the flu virus because while it's making antibodies for the flu virus and the flu virus changes, then those antibodies don't work anymore, causing more problems for your body to fight off that virus. So it's very hard for the body to keep up, and then when it doesn't keep up, that's when the opportunistic infection enters your body and causes you to get sick. According to Mayo Clinic, the risk factors with the flu virus include age, occupation, living conditions, the immune system strength, chronic illness, and pregnancy. When you're younger and older, your age matters because when you're younger, your body's trying to develop, so your immune system is still developing. And when you're older, your immune system is diminishing. So that makes the flu virus easier to enter your body, and it cannot be fought off as easily. So the flu virus is really affected by age, and the risk factors go up and down according to how old or young you are. Occupations can also be a risk factor for people because when you're around a lot of people, like in healthcare facilities and daycare facilities and retail facilities, you're coming in contact with many people who could possibly be sick or carry the virus or infection. So they're at a higher risk due to the fact they're always around a lot of people. Your living conditions also affect how you get infections because if you're like your dorm room isn't clean, then you basically just have like a little petri dish of the flu virus that just keeps growing and growing and growing, and then you're spreading it throughout the building, so everybody gets sick, and then it's just a mad chain reaction cycle. So room conditions really matter because when they're clean, you're less likely to spread diseases and infections, and people are much happier and healthier. Your immune system strength is really what determines whether you get sick or not. If you have a weak immune system, you're going to get sick. If you have a strong immune system, you're less likely to get sick, but there's still a possibility that you could. Chronic illnesses like cancer, drugs, and AIDS all have effects on your body because when you have cancer and AIDS especially, your immune system is depleted or gone. So the opportunistic diseases like the flu enter your body, and they really can kill you. They're very life-threatening at that point. And lastly, pregnancy, because when a mother is pregnant, she has to take care of not only her own body, but obviously she has another body inside of her too. So when you're taking care of two bodies, your immune system has a lot more to fight off and deal with, so it's harder to keep up. And now we're going to talk about mononucleosis. Mononucleosis is also known as mono, or the kissing disease. The National Library of Medicine states that mono is a viral infection that causes a fever, sore throat, and a swollen lymph nodes, which are in your neck, right around this area. It can be spread by saliva or close contact with people who have the monovirus already inside of them. It slowly makes people sick over time, so it's kind of hard at first for people to realize they have mono, because they could think they just have something like the flu, and here they go to the doctor and they get some tests run, and then they find out they have mono. So then they've already been in contact with other people, so then those people have the mono already inside, like on them or inside of them. So it can be just a really vicious chain reaction for mono, because people can get it and not even know they have it until they get treatment or help to get there. And some symptoms can include headache, sore throat, and fatigue, which makes you very tired all the time and you don't really feel like doing much. Mono has to run its course. There really is no cure for mono besides letting your body fight it off. There is no antiviral drugs, and what antiviral drugs they do have, they don't really help that much. Some great things to help get through mono are to drink lots of fluids to stay hydrated so your body can flush out all the toxins. If your throat hurts, it's great to gargle some salt water so you can get the bacteria killed that's in your throat. Get lots of rest so your body can charge back up and work through with your immune system to fight off all of those infections and get those lymphocytes and macrophages out there eating the infections and destroying them. And then if you need to reduce a fever, inflammation, anything like that, ibuprofen works very well for that too. Avoid people with mono at all costs. If you know they have mono, tell them they need to try to stay away from people. Remind them, I'm sure they've already been told, but especially with an RSM job, make sure you tell them to stay away from people, to be confined as much as possible. Meningitis is my third one. Meningitis is basically an inflammation of the meninges, which are in your spinal cord back here. They are, according to the CDC, there are many types of meningitis, which include bacterial, viral, fungal, parasitic, and non-infectious. Bacterial meningitis is very serious. If you have bacterial meningitis, you need to go seek medical attention right away. Viral meningitis is less severe than bacterial meningitis and usually can get better just as long as you have a strong immune system, but you should definitely still go to the doctor and make sure that you're taking the proper steps to fix your problem. Fungal meningitis is caused by fungal spores, and fungal spores are kind of affect people more who have diabetes and cancer and chronic diseases like that, because they're at a higher risk of getting the infections due to the fact that their immune system is already depleted. Some, or a lot. It just depends on the person. Parasitic meningitis is caused by obviously a parasite, but that's really less common in developed countries like the United States. So people who are traveling a lot need to make sure that they are aware that parasitic meningitis is very common in underdeveloped countries, so they need to make sure that they're getting proper treatment if they feel like they're getting sick. Non-infectious meningitis is not caused by person-to-person contact, but by diseases, drugs, or injuries to the body, and then the meningitis is contracted into the body through open wounds and things like that. It's basically transmitted through like respirations, like spores and things like that, throat secretions like saliva, open wounds, basically any opening in the body. When coming into close contact, you can spread the virus, and you should always avoid close contact with somebody if you know they have meningitis. Clean your surroundings, make sure everything's cleaned up, and bathe often. Get regular checkups with your doctor, and take your multivitamins to help keep your immune system up. Diseases are something that everyone needs to try to avoid at any cost in order to live healthy lives. Mononucleosis, meningitis, and the flu virus are all infections and/or diseases that everyone needs to be aware of while living in dorms. Remember, influenza, meningitis, and mononucleosis. These diseases can be life-threatening, and no one wants to lose someone who is close to them. So be aware of health hazards and stay healthy. Thanks for listening to my speech, and your attention was great. Thank you.